Hi, this is Dr. Elisha Van Dusen at New Hope Chiropractic. Today I'm going to talk about a rare condition that's called osteomyelitis, and what this refers to is an infection in a bone, typically caused by an infection in the blood or nearby tissues. A urinary tract infection or pneumonia can also attack a weak bone and cause this infection. Sometimes this infection can originate in the bone, especially after an injury, where the bone might actually be exposed to germs, or this can happen in puncture wounds, animal bites, or through broken bones that pierce the skin. For children, the long leg bones and also the upper arm bones are most likely to be affected. And children are vulnerable in their growth plates because those areas are softer parts of the bone. The spine and vertebrae are most likely to be affected in adults, and people with circulation issues can get this bone disease, including people with sickle cell disease, anemia, peripheral arterial disease, or diabetes as well. Diabetics may have foot ulcers and osteomyelitis in the feet, and people who have had recent surgery or injuries also can be at risk. IV treatments can also lead to this type of bone infection, as they can introduce infections into the body. This would impact those on dialysis, people with central lines like long-term IV tubing, people who use catheters. And when the immune system is severely impaired, there can be a risk of osteomyelitis, including organ transplant patients, those on chemotherapy, and also people are those who are taking corticosteroids or TNF inhibitors. IV drug users can also develop osteomyelitis. Some of the symptoms of this rare disease include pain, swelling, redness in the area of the infection, irritability, lethargy, fever, and chills. Complications of this condition include bone death, impaired growth, septic arthritis, squamous cell cancer, skin cancer in other words, and in most cases Staph aureus, a staph bacteria, is the cause of osteomyelitis. In children, the disorder is acute and it comes on quickly. It's easier to treat, and overall it turns out better. In adults, this disorder can be acute or chronic. Osteomyelitis affects only 2 out of every 10,000 people, so it's pretty rare. Typical ways of treating this medically are X-ray, CT scans, MRI. They can all be used to diagnose osteomyelitis. There's no specific blood test for this disorder, but elevated white blood cells can always indicate a presence of this infection possibly. The best way to diagnose this condition is with a bone biopsy, which can reveal the germ that caused the infection. Standard treatments also include removing dead parts of the bone and strong antibiotics. These are for severe cases. Because of these treatments, the bone infection is no longer incurable. We can actually do something about it instead of in the past where people would usually die from this. The antibiotics are typically given with a IV for about 6 weeks. And surgical processes can include draining the infection, removing diseased tissue and bone, restoring blood flow, removing foreign objects if there are any in there that are causing the problem, and also amputation, obviously a last resort. Some patients may need to be put on a hyperbaric oxygen chamber to help get more oxygen to the bone, and that helps promote healing as well. Prevention of osteomyelitis is best done by keeping things sanitized. And if there's a wound, it should be washed completely, for example. Good hygiene practices, basically. Doctors also need to know if a patient has chronic osteomyelitis, because the sooner it's treated, the better. Some chiropractic options, too, can be soft, gentle adjustments to the area, especially in the spine, hips, to enable movement and better mobility, and just help decrease the overall pain. And I hope this helps. And if you have any other questions, just contact us through newhopechiropractic.com, and we'll be more than happy to talk to you. Have a great day.